Welcome back. This is Dr. Arnav Raj, where clinical excellence meets excellent results. Today, we're going to continue on the journey of food and Hashimoto's thyroiditis. Last week, we talked about iodine and how iodine can affect Hashimoto's thyroiditis, or it can actually increase the incidence or flare-up of Hashimoto's. Today, we're going to talk about gluten. Now, it's pretty well known, even with the general population, that protein can be inflammatory and can be a trigger for Hashimoto's thyroiditis. So oftentimes, patients come in and they are already on a gluten-free diet. Now, to explain why this matters is to understand the gluten protein. Traditional testing, when you look for gluten sensitivity or screening for celiac disease, they look for transglutaminase 2 and gliadin. They look for two markers, and if you're negative for those two markers, they consider you non-reactive, so you can go ahead and have gluten. What patients don't understand, and some medical professionals don't understand, is that there are many portions of that wheat protein that you need to look at in order to determine if the patient has gluten sensitivity or not. So let's go ahead and take a look. When you look at the wheat product, it's broken down into a protein and lectins. When we look at lectins, WGA or wheat germ agglutinin, you need to test to see if you have a problem with that. There are very few labs that will do that. There is a lab called Cyrex Labs that will look at this. Do we have an issue with this part of the gluten protein or the wheat product? On the other side, when you break down the protein, you have gliadin and gluten. But you don't realize it's broken down into multiple different forms. When they do the traditional tests, they look for alpha gliadin, but there's beta gliadin, gamma gliadin, and omega gliadin. So you have to test for those markers to see if you have true gluten sensitivity or not. Is my immune system reacting to these types of proteins? Next, we have transglutaminase. Transglutaminase is broken down into transglutaminase 2, 3, and 6. One can affect skin, the other one could affect GI issues, and one of them can actually affect the brain. That's why when we have patients who have wheat problems, thyroid problems, and transglutaminase problems, we look at patients and say, do they actually have a cerebellar problem, a brain-based problem, where they might have shakiness of their hands or in their voice? Do they have balance problems? So this protein, or gluten, is not just related to GI issues. It's related to skin, nervous system function, and autoimmunity. So you have to look at all the different forms. Then we have demediated gliadin. So you have to understand that when you take the wheat product in the United States, one, it's hybridized. It's hybridized to the point where it's an unrecognizable wheat product. It's not the old ancient wheat that you're thinking about. In some parts of Europe, they don't allow wheat from the United States to come in, or their seeds, because it's been hybridized to the point where it's not recognizable. The other portion is that it's hybridized to be resistant to herbicides and pesticides. So when you spray glyphosates into these areas and prevent destruction of wheat crops because of pests and so forth, when you use these products, it binds to the product and changes the structure of the protein itself. So your body, when it ingests these hybridized wheats with glyphosate on them, looks at it and says, that's a protein, I don't recognize it, therefore my immune system is going to attack it and get rid of it. People don't realize that when you take this wheat, there was a movement for a while promoting whole wheat products as being good for you. But what they were trying to do was promote that farming industry, yet it was hurting the health of many people, skin, immune system health. If you have an inflammatory disease, an autoimmune disease, or a brain-based problem, I would say no, don't have any gluten. Today we're talking about Hashimoto's thyroiditis. For the number one food that I like to eliminate for Hashimoto's thyroiditis, it's gluten-based thyrain proteins. So if you're eating wheat, eliminate it. As a matter of fact, if you have Hashimoto's thyroiditis and you've been diagnosed with it, I would suggest going completely grain-free in order to determine if you're going to react or not. There are advanced tests that you can do. Like I said, Cyrex Labs has a test that will break this down into all its components and see if you have an immune response to this stuff. So it's important to understand why you should avoid wheat. And if you are unwilling to avoid wheat and you have an autoimmune process, then run the test. It's very simple. Run the test and see if you have a problem. If you have a problem, you need to eliminate it. My name is Dr. Arnav Raj. We'll see you guys in the next video on the Hashimoto series.